We continue our coverage now of the healthcare facility closures across the Chippewa Valley. We now know lawmakers representing the area are frantically working to take immediate action to support the people who live there. Political reporter Darielle Fair has you covered on the steps lawmakers are taking to bring emergency response services back to the Chippewa Valley.
Eau Claire and Chippewa Falls are set to experience devastating losses in healthcare accessibility as 2 emergency clinics will be closing their facilities in the coming weeks. Republican lawmakers introduced a proposal to allocate more than $15 million to support essential emergency departments in the area, but they are racing against the clock to get that proposal through the legislature before the session ends.
To absorb that many hospital beds, that many employees, that many, cancer patients and births and things like that fast is just unprecedented.
The Hospital Sisters Health System, also known as HSHS, announced closures of its St. Joseph's and Sacred Heart campuses on March 22nd and April 21st of this year. HSHS served nearly 22,000 patients in 2023, offering more than 130 medical and intensive care unit patient beds. The greater Eau Claire area not only losing those 2 major ER departments, but all urgent care and behavioral health centers under Prevea, its partnering healthcare system.
There is a substance use disorder clinic and our only detox department in that part of the state. Behavioral health beds, including the only juvenile behavioral health beds in the area.
The absence of those departments will now require ambulances to travel more than 13 miles across counties and even further for those needing services in rural communities. Republicans in the Senate and Assembly authored a bill that would transfer $50 million of unused funds previously allocated to HSHS to expand their number of behavioral health beds and repurposes those funds for hospital ER services. A second bill would create a one-time grant program through the Joint Finance Committee and Department of Health Services to provide hospitals with additional aid.
The number one priority is our ER services. Our people are hurting back at home, and we need to come up with solutions.
Lawmakers are working to fast-track the bill through both chambers. It received committee hearings for public testimony on Friday.
This is fast-moving. I actually have to talk about it in caucus today to try and garner support for my Senate colleagues. Because I still need the votes to pass it.
Republican Senator Jesse James tells me he's working to get a paper ballot vote scheduled for the GOP conference and a floor vote sometime this week. James says his main priority is getting this funding to communities in the Chippewa Valley, but his Democratic colleagues had concerns about the process he took to draft the legislation. Democratic Senator Jeff Smith and Representative Jody Emerson arguing they were left out of the conversation.
My Republican colleagues have chosen this to become a campaign issue and are not really interested in working with us on this, which is really unfortunate.
Emerson emphasizing that bipartisan efforts were needed to ensure those funds were allocated properly.
We're going to have one chance to do this, and we need to get it right. Just simply passing something isn't going to be helpful if we don't pass the right thing that's going to help our hospitals and really the people of the Chippewa Valley.
Smith told me Wednesday Democrats would be introducing an amendment to the proposal that gives the medical community an opportunity to determine how the $15 million should be allocated to best suit their needs. I asked Smith if he thinks lawmakers could pass the bill before the end of session.
That part is really on the majority party. I think that they're going to make every effort, and I applaud them for making every effort to make sure that this goes through and gets to the desk of the governor in a reasonable fashion.
HSHS also has hospitals in Green Bay and other cities. If this issue is not addressed, these closures could impact hospitals across the state of Wisconsin. Regardless, providers in the Chippewa Valley have already begun increasing access to emergency care services to meet the influx of new patients.
That was political reporter Darielle Fair. Darielle, thank you. Aspirus Health is one of those providers looking to help pick up the slack. This past week, leaders announced they plan to add more inpatient beds and enhance resources at the other clinics. In addition to the Medford and Stanley locations that offer inpatient services, patients can also be seen at the Gilman, Owen, and Thorpe locations.
As the Chippewa Valley is going through some of this transition and change, we realized that there might need to be some additional access for ED, beds, surgical services, ancillary services, and primary care clinics. And we have a number of those resources on the eastern part.
In order to treat more patients, Aspire's president and CEO Matt Haywood said it's important to hire more people so current staff don't get overwhelmed. So Aspire also plans to accelerate its recruitment efforts.